Hello my friends, I'm Kote. Today I will tell you 3 stories about headache. Let's start with most common cause of headache. Most common cause is stress. Stress can cause 2 types of headache. First, it's tension-like headache, and second is migraine. Migraine and tension-like headache are most common types of headache, and if person has headache, you can think of this both. More common and more often it's tension-like headache, and less common but still frequently it's migraine. Migraine is more severe, tension-like headache is more milder. Tension-like headache lasts for several hours, migraine lasts maybe for several days, but it also can last for several hours. Now, how stress causes headache? Stress increases level of stress hormones, which are cortisol and adrenaline. Cortisol and adrenaline causes muscle tension, and they also causes constrict of blood vessels. Constriction of blood vessels also additionally causes muscle tension. And this muscle tension is a mechanism of tension-like headache. Another scenario is blood vessel constriction can cause pain of blood vessels and nearby nervous tissue, and it is called migraine. We will explain this more details later. Second most common cause of headache is dehydration. Dehydration causes blood volume drop. When blood volume is decreased, it causes decrease of oxygen and the nutrient in blood. It causes fatigue, it causes sometimes nausea, sometimes other symptoms, and also causes headache. So low oxygen level can directly cause headache. Also, low oxygen level causes vasoconstriction, and narrow blood vessels additionally causes headache. Also, dehydration causes electrolyte imbalance, and electrolyte imbalance can disrupt normal functioning of nervous tissue and electric impulse production and distribution, and it can cause additionally headache. If we say about dehydration, most commonly dehydration is sign of tension type headache, but it can also provoke migraine. Now let's say what is tension-like headache symptoms. It's non-pulsating, bend around hand. You can sense that bend around head, and forehead is most common place of pain here, and temples. And if we say tension-like headache, you always should think about muscles. We have muscles here on the head, and we have muscles on the neck and shoulders also. These muscles also involved formation of tension headache. So tension headache is outside of head and muscles are involved. That's tension headache. And now let's say about migraine. Migraine is a very interesting disease. and it's also common condition. If tension-like headache is mostly associated with muscles of neck, head, and shoulders, migraine is most commonly associated pain inside brain. So tension-like headache is outside brain, migraine is inside brain. And what is happening? Migraine is associated with drop of serotonin level in the brain. And this drop of serotonin level in the brain can be caused by several triggers, like stress, like lack of sleep, like fasting, like tiredness and fatigue. So several triggers can provoke loss of serotonin level. Low serotonin level causes vasoconstriction. Vasoconstriction causes production of prostaglandins. Prostaglandins are inflammatory mediators, and it causes inflammation. Inflammation causes pain, and this pain spreads outside blood vessels. So first we have inflammation inside blood vessels, and this pain spread outside blood vessels, and that's why we have pulsating pain, because you know that blood vessels always pulsating, right? And if this blood vessel causes inflammation and pain nearby nerves, when it pulsating, this pain is more severe. That's why migraine is associated with pulsating headache. It's important, definitive, because in case of tension headache, we don't have pulsating headache. We have just band-like headache, tension headache. But in case of migraine, we have pulsating, throbbing headache. That's important factor. And what can be triggers? Triggers can be different things. For example, stress. For example, hormonal changes, menstruation, menopause, alcohol and caffeine intake, chocolate also can trigger, fasting also can trigger, because a low glucose can decrease serotonin level and increase stress hormone levels. Lack of sleep and sleep problems can trigger low serotonin level. And even change weather and barometric changes also can trigger migraine. And characteristic of migraine is pulsating, throbbing, light sensitivity, nausea, vomiting, and aura. Before headache, we frequently have aura. And why we have aura? Because when we said drop of serotonin level causes vasoconstriction, and vasoconstriction in the brain causes low oxygen level in the brain. Low oxygen level causes aura symptoms like nausea, like fatigue, like light sensitivity. It is caused by narrowed blood vessels. And pain phase already is painful dilation of blood vessels. When pain occurs, it's not constriction phase. Blood vessels already constricted and no headache. But when we have headache, this blood vessel already dilating and already inflamed, and already prostaglandins are produced, and it causes inflammation and it causes pain. So constriction phase causes aura, which can be light sensitivity, nausea sense, and strange sense, and visual disturbance. That's because of low oxygen level, because of vasoconstriction. And dilation is painful. Dilation causes throbbing, pulsating pain, which spreads. If we have blood vessel here and it's pulsating, and we have nearby nerves, it also this pain also spreads nearby nerves, and it causes pulsating headache. Now let's summarize and let's say about treatment. So we have most common two types of headache. One is tension-like headache, tension type headache. Second is migraine. Tension type headache is superficial. It's muscle tensions. It can be because of tension of muscles, because of stress, because of tiredness, because of lack of sleep, because of even physical tiredness. And migraine is more correlated hormone serotonin, and it's in the brain, directly in the brain. And now let's talk about treatment. Treatment of tension-like headache, tension type headache, is simple. Non-steroidal anti-inflammatory drugs are enough. Ibuprofen and aspirin enough as a rule, and no need specific treatment, and it goes away for several hours. Meditation and yoga also helps. And migraine, triptans are treatment, ergotamines are treatment, non-steroidals are treatment, botulinum injections also treatment, time to time, every 12 weeks. Exercise is good for prevention. Meditation, relaxation techniques, acupuncture also effective, and sleep hygiene is also important. Thank you for your interest. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.